Here are a few examples of peer-reviewed journal articles. The first one, Managed Care Organizations, Performance and Delivery of Adolescent Immunizations, HEDIS 1999 to 2002. HEDIS provides information through health plans to measure the quality and care of preventative services to beneficiaries. They examine adolescent immunization trends recommended by the Advisory Committee for Immunization Practices measured through HEDIS and reported a National Committee for Quality Assurance. The second one is National Committee on Quality Assurance Healthcare Plan Accreditation. Predictors correlates on performance and market impact. A healthcare organization that is accredited is usually an indicator of quality assurance. Depending on an organization, if the plan is accredited or non-accredited will determine the healthcare plan data information set through a HEDIS measure and patient-reported quality measure. Then the healthcare plan enrollment changes. Quality of care in a low-income consumer-driven healthcare plan. Assessment of healthcare effectiveness data information set. Score for secondary prevention. After the assessment of healthcare effectiveness data information sets, HEDIS, measures of secondary prevention, the results were descriptive and non-statistical measures. Future research is required with comparable population and more detailed data. National Committee on Quality Assurance is a nonprofit organization to improve organizations through evidence-based standards, measures, programs, and accreditations. HEDIS measures performance on important dimensions of care and services. Health plans use HEDIS results to figure out where they need improvement. HEDIS has many benefits, both as mentioned before. HEDIS is a tool used more than 90% of American health plans to measure performance on important dimensions of care and services. To ensure that HEDIS stays current, the NCQA has established a process to involve the measurement set annually. Who is affected by HEDIS? Quality healthcare belongs to the entire healthcare team, including the patients. Healthcare plans play a major role in ensuring that patient treatments, drug therapies, and preventative cares measures are handled in a timely, thorough, and effective and attentive manner. With this being said, it is an important tool in the quality, measure, and care for the entire healthcare team.